What if the pill you're taking to get a good night's sleep is quietly stealing your memories? What if the medication you rely on for allergies, bladder control, or anxiety is slowly clouding your mind, making your thoughts fuzzy, your focus shaky, and your memory less reliable with each passing week? It sounds dramatic, but this isn't fiction. It's science. A growing number of studies, including one published in JAMA Neurology in 2024, have shown a strong correlation between long-term use of certain medications and measurable brain shrinkage. We're talking about up to a 50% increased risk of dementia, not in decades but potentially over just a few years of consistent use. And here's the real shocker. Many of these drugs are sold over the counter and millions of Americans take them daily without a second thought. Let's get one thing straight. This isn't about fear, it's about awareness. You deserve to know what's happening inside your body. You deserve to know that some drugs, especially those classified as anticholinergics, aren't just relaxing your muscles or helping you sleep. They're interfering with one of the most vital brain chemicals you need for memory, acetylcholine. Acetylcholine is like the Wi-Fi signal of your brain. It's what helps neurons talk to each other. It's the foundation of memory, focus, learning, and mental clarity. When you block it, even slightly, your cognitive performance begins to decline. The wrong drug taken too often can quietly pull you into a fog, and eventually into something much more permanent. Let's talk about how this works. Anticholinergic medications are designed to block acetylcholine to stop things like involuntary muscle spasms. That can be useful for bladder issues or gastrointestinal cramping. But the problem is they don't just act locally. They affect your entire nervous system, including your brain. Over time, this can lead to inflammation, disrupted blood flow, and even the formation of amyloid plaques, the very hallmark of Alzheimer's disease. In fact, researchers have developed a scoring system called the Anticholinergic Cognitive Burden Scale, ACB. It ranks drugs from 1 to 3 based on their impact on the brain. Many people are taking multiple drugs that, when combined, silently raise their daily score well beyond what's considered safe. And most don't even know it. So, what kinds of medications are we talking about? Let's start with those used for overactive bladder. Drugs like oxybutynin are commonly prescribed to older adults struggling with urinary incontinence. They work by calming the bladder, but they do so by hammering your acetylcholine system. These drugs score a 3 on the ACB scale, that's maximum risk. Safer alternatives like mirabegron exist and have no anticholinergic effect, but they're often overlooked. Next up are those common stomach cramp relievers. You might recognize scopolamine or hyoscyamine, often used to treat irritable bowel syndrome or travel-related nausea. They might make your stomach feel better, but at the cost of your brain's clarity. Again, these aren't inherently evil drugs, but when taken regularly, especially by older adults, the risk builds silently. Then we come to the big one, certain antidepressants and anti-anxiety medications. Older drugs like amitriptyline and clomipramine, while effective for depression and chronic pain, are powerful anticholinergics. So is hydroxyzine, often prescribed for both anxiety and allergies. Each of these drugs carries a high score on the cognitive burden scale. That means every dose potentially contributes to long-term cognitive decline. The good news? There are modern alternatives like sertraline, escitalopram, and vortioxetine that provide therapeutic benefits without damaging your memory pathways. Now let's not forget the muscle relaxants, like cyclobenzaprine now, popular for back pain and muscle spasms. These medications sedate not just your muscles but your brain. That drowsiness you feel? That's not just relaxation. It's your brain being put into low-power mode night after night. Over time, that sedation can become chronic, dulling your cognitive edge and contributing to memory loss. And again, it carries a score of 3, the worst. And finally, the one that's perhaps the most alarming because it's so common and so underestimated, diphenhydramine and dimenhydrinate. Recognize those? They're found in brands like the Benadryl and Klaas's Dramamine. Millions of Americans pop one before bed because they help you sleep. And they do, by sedating your brain with a powerful anticholinergic hit. They're available over the counter, widely used and often taken without a second thought. But they're among the worst offenders for cognitive risk. Not because they're the most powerful, but because they're the most common. The real danger isn't necessarily one pill. It's the cumulative effect. One medication might score a 1, another a 3. If you're taking multiple meds each day, your total cognitive burden might be 4 or 5. Studies show that a daily score of 3 or higher is strongly associated with increased risk of dementia, and many older adults are unknowingly hitting that mark day after day, month after month. So what can you do? First, perform an audit to check your medicine cabinet. Look not just at the brand names, but at the active ingredients. Be a detective. Look for words like diphenhydramine, oxybutynin, amitriptyline, cyclobenzaprine, and scopolamine. Then cross-reference with the ACB scale, which is widely available online. If your score adds up to 3 or more, it's time to talk with your doctor. Second, embrace the idea of smart substitutions. The goal isn't to go off meds cold turkey. That's dangerous. The goal is to have an informed conversation with your healthcare provider about safer alternatives. For allergies, try loratadine or emfexofenadine. For sleep, explore psychomelatonin, magnesium, and sleep hygiene practices. For pain, look into physical therapy, stretching, and strengthening routines. For anxiety, ask about low-risk medications or behavioral therapy. Here's something important to remember. Your brain is incredibly resilient. Even if you've been using one of these medications for years, making changes now can still protect and even restore cognitive function. It's never too late to reduce your risk. And for those wondering, yes, these findings are backed by science. A 2025 paper linked anticholinergic drug use, not just to Alzheimer's but also to vascular dementia, a form related to blood flow problems in the brain. That means these medications may damage the brain in multiple ways, chemically, structurally, and circulatorily. The evidence is mounting, the message is clear. Awareness is power. Think of someone you care about. A parent, a spouse, a sibling. Do they take sleep aids regularly? Do they use old-school allergy or pain meds? Maybe they've started forgetting names or repeating stories. Maybe you've noticed a change and chalked it up to age. But what if it's not aging at all? What if it's reversible? This is your opportunity. Share this information. Have the conversation. You're not just protecting memory. You're potentially preventing disease. You don't need to fear your medicine cabinet, but you do need to understand it. Every drug has a trade-off. The trick is choosing the ones that help without quietly harming something even more precious: your mind. Because the truth is this: you can grow older without losing yourself. You can age with your memory intact, but only if you protect what matters most. And sometimes that means asking tough questions about what you're putting into your body every single day. Now is the time to act. Make the call, do the research, ask your doctor about your anticholinergic score. Choose smarter substitutes, start protecting your brain today, because dementia isn't just a disease. Sometimes it's a side effect.